The Centers for Disease Control and Prevention recently issued an urgent warning about a Listeria outbreak linked to deli meats. This warning is critical as Listeria is a serious infection caused by eating food contaminated with Listeria monocytogenes. Unlike most other foodborne pathogens, Listeria can grow even in cold temperatures found in refrigerators. This outbreak has already resulted in several illnesses, hospitalizations, and at least 2 deaths. The CDC's alert aims to prevent further spread and protect public health. It is essential for both consumers and retailers to take this warning seriously and follow the recommended guidelines. Listeria infections can be particularly severe, often leading to life-threatening conditions. This is especially true for certain high-risk groups including pregnant women, newborns, older adults, and those with weakened immune systems. Therefore, understanding the significance of this warning is vital for everyone. The CDC's role in monitoring and controlling outbreaks like this cannot be overstated. They provide timely updates, safety guidelines, and vital information to help prevent and manage foodborne illnesses effectively. The current Listeria outbreak has been traced to various deli meats, including sliced meats and ready-to-eat products. The CDC is working diligently with state and local public health officials to identify the specific source of contamination. This collaborative effort is crucial in containing the outbreak and preventing further cases. Several states have reported cases linked to this outbreak, including New York, California, Texas, and Florida. These states have seen a higher number of reported illnesses, indicating a widespread distribution of the contaminated products. The affected areas are under increased surveillance, and public health messages are being disseminated to inform residents. Efforts to trace the source of the outbreak involve collecting samples from various retail locations and processing facilities. These samples are then analyzed to identify the presence of Listeria monocytogenes. By pinpointing the exact source, authorities can implement targeted measures to eliminate the contamination. Public awareness campaigns are also underway, urging people to check their refrigerators and discard any potentially contaminated deli meats. Retailers are being advised to remove affected products from their shelves to prevent further exposure to consumers.
Listeriosis, the infection caused by Listeria monocytogenes, can present a range of symptoms. Initially, individuals may experience mild flu-like symptoms, such as fever, muscle aches, and gastrointestinal distress. These symptoms can occur within a few days or up to several weeks after consuming contaminated food. For high-risk groups, the infection can be more severe. Pregnant women, for instance, may experience mild symptoms but face serious risks of miscarriage, stillbirth, or severe infection in newborns. Older adults and those with weakened immune systems are at higher risk of developing severe complications, including meningitis and septicemia. The risks associated with listeriosis highlight the importance of early detection and treatment. If you suspect you have consumed contaminated food and experience symptoms, seeking medical attention promptly can significantly reduce the risk of severe outcomes. Understanding the symptoms and risks associated with listeriosis is crucial for early intervention. Public health agencies continuously emphasize the importance of recognizing these signs to ensure timely medical care.
Here are CDC's recommended safety tips and precautions. To prevent Listeria infection, the CDC has issued several safety tips and precautions. These guidelines are designed to reduce the risk of contamination and ensure safe food handling practices. First, always refrigerate perishable foods promptly and keep your refrigerator at 40 degrees Fahrenheit or 4 degrees Celsius or lower. Listeria can grow at refrigerator temperatures, so maintaining the correct temperature is essential. Additionally, clean your refrigerator regularly to prevent cross-contamination. When handling deli meats, use separate cutting boards and utensils to avoid contaminating other foods. Wash your hands, utensils, and kitchen surfaces thoroughly after handling such products. These simple practices can significantly reduce the risk of spreading Listeria. The CDC also advises against consuming deli meats unless they are heated to an internal temperature of 165 degrees Fahrenheit or 74 degrees Celsius. Heating can kill Listeria monocytogenes, making the food safe to eat. Pregnant women, older adults, and those with weakened immune systems should be particularly cautious about consuming deli meats. Finally, stay informed about food recalls and safety alerts. The CDC regularly updates its website with the latest information on outbreaks and recalls, providing essential guidance for consumers.
Steps to take if listeria infection is suspected. If you suspect you may have a listeria infection, it is important to act quickly. Early detection and treatment can prevent serious health complications. Here are the steps to take if you suspect a listeria infection. First, monitor your symptoms closely. If you experience fever, muscle aches, or gastrointestinal symptoms after consuming deli meats, seek medical attention promptly. Inform your healthcare provider about your exposure to potentially contaminated food. Your healthcare provider may recommend diagnostic tests, such as blood tests or spinal fluid analysis, to confirm the presence of Listeria monocytogenes. Early diagnosis is crucial for effective treatment and preventing severe complications. If diagnosed with listeriosis, follow your healthcare provider's treatment plan. This may include antibiotics to treat the infection. Pregnant women, older adults, and individuals with weakened immune systems should follow their healthcare provider's instructions carefully to ensure a full recovery. Lastly, report your illness to local health authorities. This helps public health officials track the outbreak and take necessary measures to prevent further cases. Your report can contribute to a broader effort to control and eliminate the source of contamination.
Staying informed through official channels. Staying informed about the Listeria outbreak and other food safety issues is essential for protecting your health. The CDC's website is a reliable source of up-to-date information on the latest outbreaks, recalls, and safety guidelines. Visit the CDC's website regularly to stay informed about ongoing investigations and recommendations. The website provides detailed information on how to protect yourself and your loved ones from Listeria and other foodborne illnesses. In addition to the CDC, other reliable sources of information include your local health department and the Food and Drug Administration, or FDA. These agencies work together to ensure public safety and provide timely updates on food safety issues. Consider subscribing to email alerts or following these agencies on social media to receive real-time updates. Staying informed can help you take proactive measures to protect your health and prevent Listeria infection. Remember, the key to preventing Listeria infection is awareness and vigilance. By following the CDC's guidelines and staying informed, you can reduce the risk of infection and ensure the safety of your food.